Hey everyone, this is John Hansbrough with the LBL Group. Today I want to talk to you a little bit about telehealth and what the future holds for it. So before we get started, hit subscribe on the channel, check out some of our other videos, hit a like if you like this one. We're trying to put as much out there as possible on helping people understand healthcare and what's impacting the healthcare system. And I'm glad you're here with us today. So telehealth. Telehealth is when you're receiving care virtually. So as opposed to going to the hospital, visiting your physician in person, what have you. Telehealth is when you're actually doing that over the phone virtually. So you might be over your computer, tablet, iPhone, Android, what have you. And so telehealth use was gradually being adopted more and more pre-COVID, right? So we were seeing small upticks in terms of Teladoc and other providers who were delivering their care virtually before 2020. Well, March 2020 hits, and all of a sudden everyone's sheltering in place and people still need to get care. And so we saw this huge increase in demand for telehealth services. But a major issue in our healthcare system and the way it operates is that care gets delivered that gets reimbursed for, right? So money determines where care goes and how it happens. So what gets reimbursed is going to be delivered. And so a lot of providers, they actually weren't reimbursed adequately for telehealth services. And that was one major barrier to getting telehealth services off the ground and getting more people using them and more providers offering them. So COVID changed everything overnight. And then in late April, CMS, the Center for Medicare and Medicaid Services, they made a change to the reimbursement patterns. And so what they said is that a lot of care that for especially your Medicare population, right, your over 65 years old population, for that visit to be reimbursed in a telehealth setting, it had to have both audio and video. Now, as you can imagine, population over 65, you could have some issues with trying to get people to understand how to use technology and make it really seamless. And so CMS recognized that and said, we need that population, especially them, right? The most at-risk population for COVID. We need them to be able to see their physicians for possibly chronic issues and whatnot. And they need to be able to do that in a home setting where they're not going to a hospital and potentially coming into contact with infected individuals. So CMS made this change and they said that care can be delivered through televisits if it's audio only. And that was a major change because it meant providers could now be having those visits with their patients, right? It also expanded some of the rules and said that occupational therapy, speech language pathology, physical therapy even, could all be delivered virtually over the phone, and that would be reimbursed for. And so that was a major change that significantly increased the uptick in usage of televisits. So a lot of questions are obviously going to come up as we're using more telehealth and telemedicine. So with the increased demand, there's certain logistical challenges for the providers. They have to have staff, they have to have managers looking over everything. They have to have significant increases in technology, although hopefully they have some of these things. But think about it, your hospital has to, every doctor now has to have a webcam. That maybe wasn't a requirement beforehand. Staffing capacity, they're going to have someone on staff who knows this stuff really well. And if there are, and not even just if, but when there are issues with patients having access to cameras and whatnot and trying to get a meeting up and running, they got to have staff able to deal with that. Best practices are constantly evolving, right? So what works really well for meetings in 1 month, get some new feedback that's going to change in the next month. And then finally, you're having to redirect patients who are used to in-person care to virtual visits. So when you have people, they get used to how they see their doctor, it can be a major change and a major obstacle to getting them to try something new. So health systems, they're waiting for evolving regulatory guidelines because that seems like they're just changing on a weekly basis right now. Reimbursement models are really important to see how those are going to evolve over time. A lot of CMS guidelines and stuff like that for reimbursement models, they tie reimbursement to outcomes. So how are we measuring outcomes from televisits versus in-person visits? That's a major question to answer. And then liability and malpractice claims are another area to keep an eye on because malpractice insurance, those premiums have been going up significantly over time. And doctors are very wary about what's going to potentially come back to them if, a patient doesn't understand instructions or there's some kind of miscommunication. And as you can imagine, doing things virtually over the phone probably is going to increase the chances of that happening. And so you've been hearing now from some doctors who are concerned with the lack of face-to-face contact, potential miscommunications, all of that contributing to a potential increase in malpractice claims coming back against their practice. And that's a real concern because if doctors are wary about the risks involved with the mode of delivery, they're going to shy away from it. It's a major concern to keep in mind. So McKinsey, which is a large international consulting firm, they conducted some research. They looked at claims data from Medicare, Medicaid, and commercial carriers, and they were doing some estimates on what care could be transitioned from in-person to virtual moving forward. And so first they looked at home health services, and they found that 35% of care could be delivered in a virtual setting as opposed to at home. So instead of a doctor or physician or physical therapist or who have you coming to your home, it can be conducted over the phone, and that's a big change. They found 24% of outpatient and office visits could be done virtually. So that's a big one as well. And then to me, I think the most interesting one is they found that 20% of emergency department visits could be transitioned to virtual. And so that's a big one when we're talking about the cost drivers of healthcare, because we need to make sure to keep the cost of healthcare down. People are accessing the right care at the right time for the right reason. Right. And so an issue is that people don't go see their primary care physician. They're not getting primary care. And then they go to the emergency department for stuff that might not really require an emergency department consultation. And so, when we go to groups, we're talking about helping educate their employees on how to access urgent care when they have a real urgent care kind of issue, right? Emergency departments, more life-threatening. Urgent care is something that, it's an issue, but you're not going to potentially bleed out or die if you don't get care in the next 20 minutes. And so that's a lower mode. It's a lower cost mode of delivery in urgent care as opposed to emergency departments. And so when 20% of emergency department visits could be transitioned to telehealth, that's a big impact and a potentially big difference for those payers, right? So is this going to be a short-term or long-term change? I think it's going to be kind of both. I think you're going to see certain aspects of telehealth stick around just for a short period of time until things start to get back to our whatever normal will be. I do think, though, that other aspects of telehealth are going to stay around long term, and our new normal is going to include them in some way. They're going to be incorporated. Is this going to be a short-term change or a long-term change? I think it could be kind of both, and here's why. Short-term changes are going to only be around for a little bit of time, and I think certain aspects of telehealth are definitely susceptible to that. People have ways that they want to access care and how they want to see their doctor. And I think that they're going to deal with telehealth for a short period of time, but at some point they want to get back to what they were used to. So certain aspects of telehealth are only going to be around for a short period of time. Long-term, though, especially Medicare, Medicaid, and older populations, and as increasing technology gets more, permeated throughout the population, I think certain aspects of telehealth are going to stay around long-term. So questions to answer there are, how are those integrated within care departments? And so we need to see that in health systems, because telehealth could be victim to just becoming another department within a large health system. And that makes it difficult, because then now they've got to interoperate with all the other departments and have lines of communication. That could be kind of tricky. I think alternatively that we're going to see telehealth be adopted into each department of care. And so you're going to see that, your burn unit is going to be, handling patients in person and whatnot, but then some of that outpatient care can be conducted over the phone and virtually. And so we're going to need to see all these different clinical settings incorporate telehealth, right? And they're going to need to all be able to handle it on their own, as opposed to outsourcing that to the telehealth department. I think that's where we're going to see this go. So it's just another mode for care delivery. It's going to have major impacts on how care gets delivered and how it affects outcomes. So we just need to keep an eye on what's going on, because this is constantly evolving. What makes sense and is current today is not going to be the same a month or a year from now. So just keep an eye on it, see how regulations change, because as we talked about, what gets reimbursed gets delivered. And just keep an open mind, because telehealth, there's so much potential for it. But there's also some pretty significant barriers in care delivery and consumer comfort with the system. So it's constantly evolving. We're probably going to do an update on this at some point in the future as things change. But thank you for staying with me and hearing about telehealth. Got a lot of potential to change things, but like we said, a lot of barriers to it. This has been John Hansbrough with the LBL Group. Take a look at some of our other videos, hit the subscribe button, and I'll see you soon.